Today I'm going to talk about a most common benign uterine mass, commonly known as a fibroid. It is estimated in Kenya that 20% of female may be having fibroids. Today I'm going to answer questions. What are these fibroids and what causes fibroids? What are the signs and symptoms of these fibroids? How do we diagnose myomas? How are these fibroids diagnosed? What causes these fibroids to either enlarge or reduce in size in a normal setup? Do fibroids cause infertility? Can fibroid cause problems during pregnancy? Are these fibroids treatable? And the answer is 100% yes. This is Radiology Simplified, and today I'm going to talk about a most common benign uterine mass, commonly known as a fibroid, also a leiomyoma, and another name, a myoma. And it is estimated in Kenya that 20% of female may be having fibroids. And according to recent population estimates, 2025 to 2026, we are 58 million here in Kenya. And so 53% of the population is female. So they are estimated to be maybe 29 million. And 20% of that population is more than 5 million. So it's an alarming thing. More than 5 million women may be having fibroids. And today I'm going to answer questions yenye watu wanauliza sana about fibroids. The question watu wanauliza sana ya kwanza ni what are these fibroids and what causes fibroids? So a fibroid first, it is benign uterine mass made up of fibrous tissue and muscle. It originates from the uterus or within the uterus or around the uterus. And good thing about fibroids is that they are benign. Benign meaning non-cancerous. Yeah. So what causes fibroids? The sole cause is not yet known. Hakuna ile kitu wamesema hii ndio inasababisha hii. No. But in discussions there are things called risk factors. These are factors that when someone is exposed to is most likely to get fibroids. And I'll discuss them. There are very many, but Kenyan or African women are different from other women, and there are factors that affect other women in different areas compared to women in Kenya and Africa. The first risk factor that can cause someone to have fibroids is our already existence as Africans. So it is said that African women are likely to get fibroids 3 to 9 times more than Europeans. Yeah, and there's a lot of backup information about this. Wanasema African genetics may be related to fibroids. Wengine wanasema our environment, but yenye ko more direct related is our black skin is made up of melanin, and melanin causes the low production of vitamin D. So, and vitamin D deficiency has direct relation to fibroids. Watu wenye kona vitamin D deficiency are more likely to get fibroids. Yeah. So even if you are an European and you have less vitamin D, you are more likely to get fibroids. Another factor is family history. Your mother may be had fibroids, your sisters, and you may also likely to get fibroids, and around the world may. So the last and the more, it's more actually hormonal factors, prolonged exposure to hormones. And when you check right now, almost all female pathologies have a relation to hormonal factors. Watu wenye wa kwanza they are not lucky is obese people. Obese people, a lot of fat kwa mwili. There's an enzyme called aromatase converts fat to estrogen. Unapata obese people, their estrogen levels are more likely to shoot. And another factor is when someone started her menses very early, so inamaanisha she got more exposed to hormones for a very longer time. And the last one is dietitian. Dietitian is related to what we take right now. Milk and meat products, most of these animals are being fed with growth hormones, and when we take them, our endocrine perceives them as hormones, and they may have the same hyper fluctuations of our female hormones. So what are the signs and symptoms of these fibroids? The first and most common one ni heavy menstrual bleeding, ambayo inakosingi hata mtu anapatwa na anemia. Another sign and symptoms is painful menses. Painful menses is not normal. Menses zinafaa zikuwe cramping, but ikifika ni uchungu mpaka inabidi umeze painkillers, so that's not good. Another signs and symptoms is pelvic as a pelvic mass ama pelvic floor pressure on the pelvic region. Unasikia uzito kabisa, and even wewe mwenyewe uzajigusa hivi kwa tumbo usikie kuna kitu ugumu fulani. That's one sign. And even other people, by the way, unaweza sema unalala na side unasikia kama for big myomas, you find that when you ukilala na side unasikia there is a bit of movement of something ndani yako imesonga this side and opposite inasonga. Wengine huwa wanakuja scan wanasema they are pregnant. Na vile fibroids zingine huwa they increase the belly size, anafikiria ni mimba, but when you do a scan you find that is a myoma. Mtu anakwambia nasikia kitu inacheza ndani ya tumbo, actually it's not a baby, it's a fibroid. Another signs and symptoms is due to this mass, it may cause pressure problems. It may zenye ziko kwa posterior wall, when they apply pressure to the rectum, mtu anaanza kuwa na constipation. Ama hizi ziko anterior, zi apply pressure to the urinary bladder, mtu anakuwa na frequent urination. And these are just signs and symptoms. And na wengine ni wenye huwa they have infertility problems. Anasema mimi nimekuwa na difficulty in getting pregnant, and when we do a scan we find that you have myomas. So another question people ask ni how do we diagnose myomas? Kwa diagnosis ya myomas, kitu ya kwanza I told you ni signs and symptoms unatuambia, na kitu ingine ambayo tunafanya ni pelvic ultrasound scan, and this is where we come for help. Another question people ask is how are these fibroids diagnosed? So when the doctor hears about your signs and symptoms and he thinks of fibroids, the primary tool inatumika for diagnosis of fibroids is an ultrasound scan. Na ukikuja tukufanyia scan, this is what we see actually. We see the uterus is bulky if you have fibroids, na iko na masses. So kuna kuangana very important information daktari wanataka kujua about these fibroids. Ya kwanza ni the number of these fibroids. Ya pili ni location or site of these fibroids penye iko. Na ya tatu ni size, so very important. Actually on the site inafaa useme when we give our reports we give it there are 3 types of fibroids, yenye iko ndani na hang ndani ya kizazi, yenye mpaka ndani ya endometrial cavity penye mtoto huwa anakaa ndani ya endometrial inaitwa sub. Kuna ingine mpaka it's hanging, it has a stalk in a hang, inaitwa pendulating submucosal myoma. Zingine zenye ziko kwa wall but they are bulging inwards into the endometrial cavity, they are submucosal. Yenye iko ndani ya within the myometrial wall, they are called intramural myomas. Na yenye iko nje zinaitwa subserosal, mpaka kuna yenye na hang na nje inaitwa pendulating subserosal. And we give information according to site kabisa, iko wapi, is it bulging inside, is it inside the nini, ama iko bulge outwards. And there is a classification sahi iko, we classify inaitwa Figo classifications of fibroids. So we classify Figo classifications from 0 classification to 7. Yenye ina bulge ndani kabisa, bulge ndani tunaita Figo 0. Paka ile ina bulge nje huko nje na ina pendulate nje na called ni Figo 7. So when we find a fibroid, we classify it kabisa according to site na location, na hata hivyo according to uterus penye iko juu, inaweza kuwa kwa fundus, is the upper side of the uterus, ama iko mid uterus, or is near the cervix, because all these fibroids have, according to site, they may cause different problems if they may come. When ultrasound haitapeana good information, MRI is advised, but rarely is it used, manake ultrasound is the best and primary tool for diagnosis of these fibroids. Another question people ask is, what causes these fibroids to either enlarge or reduce in size in a normal setup, hata kama mtu aje jieka under medication. And we found that a fibroid in relation to normal myometrial, normal uterus muscle, sindio? Uterus is a muscle. So it's found that myomas ziko na more estrogen receptors according in relation to normal uterine muscle, na pia there are more aromatase enzyme ile ya kuconvert androgens into estrogen ndani ya fibroid. Na this explains why mtu akiwa na pregnancy, let me not talk about pregnancy first, let me talk about mtu ako hormonal replacement therapies. Ukiwa nayo na you have a fibroid, the fibroid may likely to increase in size. Ukiwa na implants, the fibroid may likely to increase in size. Ukiwa na polycystic ovarian, I told you about polycystic, mtu akiwa na polycystic akona, she may likely have estrogen dominance due to lack of progesterone, manake they don't some of them don't ovulate. And another thing ni watu obesity manze, obesity due to fat estrogen, unapata the size of the fibroid ina increase in size. And pregnancy, watu wanaulizanga, and people ask if you get pregnant the fibroid may reduce in size or thing. And I found that there is no direct relation to pregnancy and reduction in size of a fibroid, lakini ni hormones bado tu they work on this, manake when you get pregnant, hormones are high at that moment when you are pregnant for that 9 months. Hormone levels are high, and this may cause, if you have a fibroid, this may cause this fibroid to increase in size. And when you, after delivery, the hormones drop, and this may cause the fibroid to shrink. Ndio maana watu wengine wanasema tukizaa inaweza reduce in size. Yeah, inaweza. Manake when after delivery the hormones drop and it may reduce in size. So you get to see that the growth of these fibroids are hormonal driven more they are more of hormonal driven. And the last one that confirms this is menopausal women. Na watu wanafanya scan, they can give evidence of this. Manake menopausal women unapata, by the menopausal women, you may have a fibroid and continue bleeding, not because you are continuing with your menses, but the fibroid may cause you to continue bleeding. But menopausal women, we see that the fibroid yenyewe iko na maybe a hyperechoic rim with around it, so imeanza kucalcify. Now hata akiendelea miaka mingi, tuseme ako 50s and 60s 70s, you find 70s 60s unapata imekuwa hyperechoic na hata imeshrink, imekuwa smaller. Yeah, so imecalcify na imereduce. Why? As this happened due to hormones kwa watu wa menopause huwa zina drop. Manake you don't need estrogen and progesterone, a lot of them. Even the size of the ovaries huwa zina, tunasema the ovaries, they atrophy. So there is less production of these hormones, and there is actually reduction of estrogen and progesterone. Another question people ask is, do fibroid cause infertility? And the answer is yes or no. So yes and no. So the yes answer, I told you earlier, huwa tukidiagnose fibroids tunapeana very important information on size, site and number. So the fibroids that are submucosal na ni kubwa and their sizes are big, they may cause a problem with endometrial wall distortion, ama zingine zina finya fallopian tube mpaka kuna na blockage, even the sperm can't reach there to enable fertilization, something like that. Even during wengine fertilization has happened, and during implantation, the fetus cannot implant itself kwa fibroid due to oxygen concentration, mambo na vascularity at that fibroid. So fibroids that are submucosal more, and the larger fibroids, easy figo, maybe figo 0 to 2, they cause a lot of problem with fertility. But the no answer, wengine ni no, wengine wanazana fibroid actually, but kitu inakuwa important ni location yenye iko maybe kwa intramural ama iko imebulge na huko nje, so the endometrium haipati any difficulties on space or distortion or anything about the baby. Another question is, can fibroid cause problems during pregnancy? As I told you, wengine wanaweza za paka mwisho kuna fibroid, but inategemea sana location. As I very normal pregnancy, when normal kabisa, no any problems, but wengine maybe the fibroid is submucosal, is within the endometrium, kunatokea na space problem, which may, fibroids are very tough. They are made of fibrous tissue and they are very tough, and this toughness may cause miscarriage due to space problem between the fibroid and the child akiendelea kuwa mkubwa. And others is there is other fibroids, they can be even intramural, maybe they are not affecting the space or what, but they cause a trigger, they irritate the uterine wall, uterine wall, and that's in a cause. They trigger contractions, early contractions actually, which may cause miscarriage or preterm labor. Another thing is a problem that fibroid can cause during pregnancy ni location during birth, wakati mtu anataka kujifungua. Fibroids that are located near the cervix, near the cervix and maybe they are big, they may cause problems actually. Inabidi other doctors kama inaweza cause problems that the child cannot pass easily, inabidi they seek other options, and those are effects of fibroids during pregnancy. Another question that people ask about fibroids is, are these fibroids treatable? And the answer is 100% yes. But on treatment there is a variety. It varies a lot according to situations and a lot of things actually. Hapa ndo unasikianga pata ushauri kwa daktari. Why? It depends on a lot of factors that the determinant is the patient in a lot of these situations. Manake lemi situations kama mtu amekuja, maybe she never knew if she had the fibroids. Amekuja tu for other things, lakini tukampata na fibroid yenyewe is asymptomatic, haionyeshi any symptoms, haumii, hagonjeki, hafanyiki kitu chochote. So someone like huyo kufanyiwa surgery and sort of management kama hizo haina maana kwake. So mtu kama huyo ni maybe tu wa manage symptoms, waangalie maybe kama zitamletea shida, but there is no need of surgery or management adverse kama hizo. So mtu mwingine ni maybe umeshamaliza conceive wewe, mambo na kuzaa, and you have a fibroid, so the need of surgery ama nini management kama hizo hakuna, yani si ya maana sana. But hii ni conversation between you and your doctor. Actually you talk to your doctor, he or she gives you advice on what to do according to the situation. Manake kuna different types of management. Kuna medications, kuna yenye wanafanya ile hatari inafidio mayoma wanaitoa. Kuna surgery ya removal, na surgery sana sana ni watu ambao hii fibroid inawaletea a lot of complications kama anemia, na sana sana ni watu wenye kuna multiple enlarged fibroids. Inakuletea anemia, unapitia a lot of pain, ziko multiple mpaka wameona there is a lot of problems, so they wanaamua kutoa. If it's one, they can remove the fibroid. If they are multiple and they are causing a lot of problems, they can, so sad, they remove the whole uterus. It's called hysterectomy. So management varies. Management has a lot of variations depending on your preference, you and your doctor preference according and in relation to what you want. Kama ingine tuseme example, it's a submucosal, you are in your reproductive age, unataka kupata ujauzito early, and iko ina bulge into the endometrium. So doctor can advise for hiyo myomectomy waitoe, and you get pregnant. And by the way, there is no direct relation that when you have a fibroid wakitoa utapata pregnancy.